Yeah.
So, Dr. Nkuli, thank you
There we
so
go.
much for making time on this special day to share your insights into the future of leadership.
Fantastic. Thanks for having me, Dr. Nick.
You're most welcome. It's great to have you on the show. But before we start, can you tell us a little bit about your backgrounds? Where did you grow up?
Well, I am a full Johannesburg girl. I was born at Chris Hani Baragwanath Hospital, as you know, the biggest hospital in South Africa. I'm from Soweto. Soweto, which is a famous township in Johannesburg.
Yeah.
I went to school, interestingly enough, at the Deutsche Schule from the age of 9. Yeah, so at the Deutsche Schule until I finished matric. So from 9 until the age of 17, I was there. And yeah, and I went to medical school in Johannesburg. So I'm a full Joburg girl through and through. Undergrad, postgraduate medical training was all done in Johannesburg.
And Dr.
Maybe it's time
Nkuli,
for me to move.
Dr. Nkuli, can you tell us what was your dream career when you grew up?
So my dream career has always been in medicine / something within the healthcare industry, because I've always thought I want to help people as a child, and so it sort of always landed itself towards medicine, and that's what I loved and I was passionate about from a very, very young age. I remember we had not a career day, we had a famous person visit us at school. I think I was 7 or 8 years old, and that's what I said. I want to help people and work in a hospital. That was always been my interest.
And can you tell us who inspired you? You mentioned one. Who inspired you in your early days?
So I suppose for me, because I've had a very interesting journey from childhood in terms of just my experiences in healthcare. At the age of 9, actually on my first year at the Deutsche Schule, just day before the Schul Bazaar, I was involved in a bomb blast in the middle of Johannesburg town. It was during that time when South Africa was transitioning from a democratic society. And so there was a lot of civil unrest. I remember at that time, people were even thinking we may be at the brink of civil war. So there was a lot of attacks on certain key points. And so I was in a bomb blast in the middle of Joburg. And I was in hospital after that accident. And so just that experience, and then later on in my life, then I developed cancer. And so I spent an extended period of time in the hospital as a child. I was about 14, 15 at the time. And so just that experience for me sort of reaffirmed and confirmed what I've always wanted to do, which was to be in that space. And so I was forced into interacting and understanding the healthcare space. And despite that experience, I still very much enjoyed it and wanted to be there. And so that's really what inspired me to go into healthcare.
Thank you. And Dr. Nkuli, looking back over your career, your leadership career, would you say there was a turning point or maybe a number of turning points where things could have gone differently?
Absolutely. I think the biggest turning point for me in my career, I'd always thought I'd be a neurosurgeon. So that was the first dream, a neurosurgeon or a surgeon of some kind. And I wanted to do pediatric surgery at some point. And when I started working in the peripheral areas of Johannesburg and looking at some of the difficulties that patients face in accessing healthcare services, and even healthcare workers working on the ground, you don't have the tools that you need to work. We fight over the limited resources to treat our patients, And so for me, that was a turning point to say, look, I would have loved to be a surgeon. But I think I'm more interested in understanding the healthcare system, how it works, how is it managed, because how is it right that you don't have the things you need to work, but somehow you're expected to deliver a quality service and save lives, but you don't have the tools. And so for me, that moment, working in a particular hospital, I just felt I want to make a difference in a different way, because a lot of us who are clinicians and doctors, we love patients, we love to be by the bedside, and a few of us go into leadership roles. And I think it's important for some of us to go into these roles and bring with us the experience of being on the ground. And so that was the critical turning point in my career. And then I pursued my fellowship in public health medicine, which really gives you a broader view about healthcare systems, leadership, finance, all those kinds of corporate on the business side of medicine that I really was interested in and wanted to make a contribution. So that was the turning point for me.
And Dr. Kuli, what would you say is driving you today?
So my biggest driver, I'm a patriot, and I won't lie about it. I love South Africa. I love my country. And not only that, I'm passionate about children's health and just children's well-being as our most vulnerable. And so for me to see a better South Africa, a South Africa where we can all prosper, where my children can grow up safely and achieve their dreams, are the things that drive me today. And I want to make a contribution in the little space that I'm in to a better country, because I still very much believe in the potential South Africa has. We've seen it. It's a beautiful country. And so for me, I just want to make a contribution to make sure that our children and the community that we serve is taken care of. So that's really my driving force every single day.
Thank you. And Dr. Kuli, looking into the future, and I know it's a big question, but what does the future of leadership mean to you?
Right. So future of leadership means to me to promote accountability. I think as leaders, we need to take responsibility of our roles and the decisions that we make. And not only that, we need to be people who you live what you say you are, you lead by example. People are no longer interested in what you have to say. They want to see, what are you doing? Are you doing the things that you say you would do? And so that speaks to integrity. Leadership you need to have integrity. People are no longer interested in stories. They want leadership that has integrity. And not only about integrity, you need to have empathy and you care. And if you have empathy for the people that you lead, you can stand in their shoes. You'll be able to deliver on the needs that they have. So that for me really is about leadership today. Be who you say you are, deliver what you say you are going to deliver, and don't tell people the long stories. And so for me, that's what leadership should be. Going into the future, and just remember to be empathetic. It's no longer just about sticks, it's about understanding the people that you lead and walking the path with them. But further to that as well, to be able to lead and walk with people, you need to be courageous. And that's what I found even in my work environment. If you don't have the courage to make the difficult decisions sometimes, then you shouldn't be leading organizations. You need to be courageous, take accountability, and lead with integrity. So that's really what I think the future of leadership should be for us, whether in the corporate space or in the country.
Thank you. And Dr. Kuli, what would you say? What is it we have to do more to build future leaders, to empower future leaders, to encourage future leaders?
Yeah. For me, it's important, first of all, because I'm a relatively young person, and so it would be very good to be mentored. In my experience, what I've seen, that coaching and mentoring, and just to have that support, people around you who have walked the walk, who can give you advice, because you can go and get an education at school, right? You can go and get an education and get your MBA, your MBLs, your PhDs, but nothing I've learned replaces experience, right? What you learn on the ground is invaluable. And so the experience that other people have had on the ground, and to make sure that we strengthen our leadership programs and coaching, informal and formal coaching, is what needs to happen. And just also to be given the space to lead, and not always believe that you have to have certain things, or you need to be a certain age, you need to be a certain gender, and so it's important to say, let's not profile. Leadership can come from any area, from any individual. And so with the right kind of leadership, with the right kind of support and mentoring, I believe that will help to empower future leaders, young leaders coming through the ranks. Yeah.
Now, Dr. Kuli, these are challenging times as the world is stumbling from one crisis into the next. What is your advice for future leaders in terms of challenges? What are some of the biggest challenges they should expect to encounter and hopefully overcome in their career?
So some of the the big challenges that we cannot shy away from is that, first of all, I've realized that we have a changing workforce, right? And I'm not changing in terms of people, but changing in terms of their desires, their wants, what they prioritize. You know, people want to have good quality of life. And so it's important that a leader needs to be flexible, needs to be nimble, you need to adapt. You know, in order for your organization or your business to thrive, to understand that it's a different time in terms of the workforce. It's no longer, you know, the younger guys, the millennials, your Gen Zs, their priorities are a little bit different. And so how do you appeal to a younger workforce and be able to reach the objectives that you need to reach? And with everything that's happening, looking at environmental issues that are hugely impacting our ability to do work. And so in South Africa, we all know we've got load shedding problems and all of that. So the constraints globally that exist, even with climate change was not a big topic 10, 20 years ago. You know, we all thought maybe it's a theory, you know, and so it's important for leaders to really understand the context in which they're operating and how the environment will impact, you know, the political environment, the environment, and how it lives. So those are some of the challenges that we're facing, and you see it globally. It doesn't matter which leader you talk to, whether it's somebody from the US, from the East, we're all facing similar challenges. And what COVID has shown us, I mean, that was a global pandemic that we hadn't seen in decades, you know. And so how do we recover even from a global pandemic like that? I think for us in the healthcare space, you're still very much feeling the impacts and the repercussions of COVID. So that's really the major, the leadership challenges that you face. And how do you stay relevant, you know, in the technology and advancements and AI? So how do you continue to become a relevant organization with the changing times that are rapidly happening in our society today? Yeah.
And Dr. Cooley, if you were to design a curriculum for future leaders, what are some of the new skills you would want to factor in?
So I think for us, the issue of technology, right? I think technology has become such an integral part of how we work, of our lives, you know. My own children were teaching me, and they're like 8 and 11, they were teaching me how to use my new phone because it's become so intuitive for them. And so I think as part of any curriculum, you need to look at how technology, your finesse around it, your understanding of it is important, but also learn about the soft issues as well, because at the end of the day, you are still dealing with humans, right? We're not all robots that are doing the work. There's a human factor involved, and that the human element cannot just be left to the human resources department, right? So as a leader, you need to understand empathy and how do you deal with be conscious of the impacts of the work on mental health, as we're seeing even rising rates of suicides among young people. And so how do you, as a leader, sort of manage and juggle all those expectations in the environment? So definitely, those would be my two topics: technology and dealing with the softer issues.
Right. And Dr. Cooley, as a mentor to so many future leaders, can you maybe share a success story or two where you mentored an upcoming leader and that person took your advice to heart?
So so I have a few people, you know, you mentor officially and unofficially, and the one I'm very proud of, you know, she's interesting enough, she's not even in the healthcare space, she's in the automobile industry. And so for me, she's just one of those success stories in that she reached out to me, asking for assistance, and we discussed a lot of things, and she's grown very much in her career. She's managed to complete her studies, and I have quite a few of those examples where you're just assisting people to navigate their lives, not to give up when they fail. Some of them I'm related to, and so those are really some of the learnings that I've managed to transfer to colleagues and to younger people that I've worked with and have mentored.
And Dr. Cooley, looking back over your leadership career, are there any role models of leadership that you encountered and maybe worked with that you would recommend future leaders should learn from?
Yeah. So So definitely, so some of the people I've been lucky enough that even on the board that I sit on, some of the people that I've worked with, so the lady who founded the Nelson Mandela Children's Hospital, for example, I've had the opportunity to work with her, and just the way, the tenacity that she showed, the dedication, the commitment to be able to build such a huge project, for me has been really, really inspiring. And so those are the types of people that I think people can tap into, learn from, you know, especially because they've worked in an environment like your own. I also have a mentor. He's the previous outgoing CEO of a children's hospital in the US. So because I believe in having different types of mentors just to get different perspective. And so someone like him has got a wealth of experience within the space that I'm in. It's very useful for me to be able to grow and in my role. So those are some of the people that I've met. But there's so many other people I'd love actually to meet that I haven't met before, who have led political parties, countries, especially as women, you know, and so just to understand it and how they've navigated the leadership challenges that come with being a female in certain spaces. Yeah.
Right. Now, Dr. Cooley, where can our listeners follow you and how should they connect with you?
So I'm very active on social media. I like to share some thoughts and stories on LinkedIn, and so they can follow me there. Instagram is really for personal things, but really from a thought leadership point of view, I like to use the LinkedIn platform with people who want to listen to what I have to say. Yeah.
Right. And last but not least, Dr. Cooley, if I may ask, in terms of your leadership legacy, what is it you would like to be remembered for?
I want to be remembered as somebody who cared, not so much for the successes we have financially in taking care of children, but who cared for the people who I work with and who cared for the children that we look after, you know. So if that's the only thing they can remember me by, is that at the very least, she cared about what she did. She was good at her job, but she cared. I think a lot of us don't really care anymore. We do it for money or whatever, but really that you care for the people that do the work and the recipients of the work that we do. That's if I need to be remembered, that is.
Thank you. Thank you, Dr. Cooley. Thank you so much for making time on this important day and for saving so many children.
Thank you so much. Yeah, and we're very excited to be able to do the work that we do and the support from people like yourself who take the time to talk to us and hear our stories. So thank you.